Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna talk about how you can correct kyphosis. But before I do that, I'm gonna cover the symptoms, the different types, and then we'll go over natural treatment for kyphosis structure issue. So what is kyphosis? Kyphosis is abnormal curvature in the spine, and it's typically in the thoracic area, around this area, or a little bit lower. That's most likely where it occurs. And the symptoms usually round shoulder, and some patients might experience some pain in the mid-back and stiffness in the spine, and weaknesses. Part of the symptoms experiencing stiffness in the spine and also tightness in the hamstring area, which is the muscle that in the back of your thigh. So when we look at the spine, this is normal curvature. Actually, we should have some kind of curvature like this. But when someone has kyphosis, they usually have excessive curvature around this area. You can see it in this image here, excessive curvature here. And one of the classic tests for kyphosis is when you bend forward like this person, you will see the hump very visible. So that is a test to confirm the kyphosis. Also visually, you can see it here. And when we look at normal curvature, this is normal curvature, like the spine I have here in the model here. When you start to have kyphosis, you start to have a structure issue here. So what are the types of kyphosis? The first type, the most common type, is this posture kyphosis. That can be treated very easily. The second type is the Shoremon's kyphosis, and the last type is the congenital kyphosis, which present at birth. So someone is born with the kyphosis already. So the first type of kyphosis is called posture kyphosis. So that is the most common type of kyphosis. Some patient might experience pain, but it's really to experience pain. If it's prolonged, that could cause pain and structure issue that over time, by age 70 or 80, it's hard to correct. Some patient can correct it, but it's better to address it in early stages. So I'm gonna show it to you and myself. So the kyphosis usually can be corrected when you straight up like this. So posture kyphosis, usually you will see those people hunched forward, round shoulder like this, and the curvature is excessive in the back here, but it can be corrected. Some people need release first before they be able to correct it. So I'm gonna go over the protocol for that in a few slides. The second type is the Shoremon's kyphosis, which is similar to the posture kyphosis but with excessive curvature and affecting 3 consecutive vertebrae in the spine. And you can see it here when they take X-ray. You can see a sharp angle here for the kyphosis. It's more likely structure, but it can be corrected if it's addressed in the right time and the patient compliant with the program. It usually affects the thoracic spine and sometimes the lumbar spine. And it can be painful sometimes for a patient that have it for a long time, because this structure gonna cause more, decrease the range of motion of their lung. They will have restriction in breathing. Also, they will have a lot of tightness in the back, in the shoulders, lower back, and over time, if it has not been addressed properly, that will lead to chronic condition, low mid-back pain, and neck pain. So this is a very good image to visualize how significant the effect of kyphosis on the neck. So when we look at this person, especially with the bad posture, when you are in neutral position, your neck in the 0 degree, your head weighs 10 to 12 pounds. Now when you start to slouch forward, like the image all the way in the far right, your neck weighs 60 pounds. Think about this way, the kyphosis person that's stuck in this position, that is a 60 pound all day long, that their neck muscle has to carry and compensate for. So those patients, they will have a lot of scar tissue in the trap area, a lot of scar tissue in the mid spine, and a lot of tightness in the shoulder. They have a lot of strain from that posture, and if it's not addressed in early stages, it will lead to chronic condition. So how to correct the kyphosis issue? Before I answer this question and we'll go over the proper treatment for the root cause of kyphosis, we need to understand the normal healing cycle. So the treatment will make sense and you can focus on the treatment that works and avoid the treatment that actually does not work. So normal healing, our body has to go through 3 stages in order to heal. I'm gonna use external paper cut for visualization, but the same process happened internally. From the kyphosis, for prolonged time, you start to have a lot of scar tissue, a lot of inflammation. So when you have a paper cut, your body start to, the inflammation stage, that's when you start to have like swelling, redness, the blood start to rush to that area, and you experience pain, decreased range of motion. Second stage of healing, it's called the proliferation stage. That's when your body starts to build a scar tissue. You can see it here in the second image. During the proliferation stage, there is a cascade of events: scar tissue, fascial restrictions, muscle spasm, and trigger point. This is very important because it's very relevant to the kyphosis. There is a lot of scar tissue, there is a lot of fascial restriction, there's a lot of muscle spasm and trigger point, and that's what cause actually, if it not addressed properly, correctly, it's gonna be a chronic kyphosis that will have other issues from restriction in the range of motion, pain. The last stage of healing is a maturation stage, and that's when your body starts to get rid of the inflammation and everything in the proliferation stage and clears up. That could take days, weeks, months, or years. As we get older, the speed of and the process of the healing decrease significantly. So when you have kyphosis, you're typically going back and forth between those 2 stages, inflammation and proliferation stage. You don't see it because the skin cover it, but most predominantly because this structure issue is affecting the musculoskeletal system. There is a lot of scar tissue, a lot of fascial restriction, a lot of muscle spasm, and that's what actually could lead to prolonged kyphosis and other issues related to the complication for not treating it properly. So you can see in this image when your muscle normally look like nice and smooth like this, when you start to have a strain or micro tear in the muscle, it happened randomly here. Your body has to build a scar tissue in order to heal. That's the glue that keep all the tissue together. If your body does not build a scar tissue, if you have a paper cut like this, it's going to be open wound susceptible for infection. We need the scar tissue. The problem is when you start to build excessive scar tissue like here, that's going to be in the way of everything. Why that's a problem? Because our muscle should act like a rubber band when contract and relax, stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, it will not stretch much. That's why a lot of current treatment that doesn't work, they teach patient to do stretching, but it's not gonna work because you have knot, you have a scar tissue that limited your range of motion. It's not gonna last the treatment. So the thing is, we need to really remove the adhesion, break down the scar tissue, the excessive scar tissue, and then correct the posture issue. And that's usually the long-term result for treating the kyphosis issue. So back to this image, as you see on the far right image, when you are in this position for a very long time, your head weighs 60 pounds. That's gonna cause micro tear because your muscles here not built to carry 60 pounds all day long for 5, 6 hours or 8 hours. And if you are in this kyphosis position, you're gonna develop micro tear internally, so your body gonna build a scar tissue. And I want you to try now bring your hand back to your trap area and push down. If you start to feel like a knot or a rock feeling or like very hard tissue, that's a very good sign of a scar tissue. And when you have that for a very long time, I can say to you forever, it's set up nice and tall, but because those restriction, it's limited the range of motion of your muscles, so it will be hard for you to maintain this position for a very long time. It's like you carrying 20-pound extra. So the right way of correcting this issue is we need to release everything in the back and then correct the posture with core stabilization and exercises. So before I go over the proper treatment for the root cause of kyphosis, I'm gonna go over common treatment that doesn't work based on the studies, and also when we look at the normal healing cycle, it will make a lot of sense why this treatment does not work. One of the common things that use to relax the muscle, decrease the inflammation is steam, heat, and ice. But when we look at the normal healing cycle, that's not going to break the scar tissue, that's not going to release a muscle spasm, and actually studies shows it provides temporary pain relief. If you're lucky, going to be for half an hour. So it's not really doing much to the inflammation or the proliferation, so it's not treating the root cause of the problem. The other thing that use massage and foam roller, and when I go over the scar tissue and the fascia system, it would make a lot of sense why foam roller and massage do not work. And based on the studies, it either provide temporary pain relief or no pain relief. And when you look at the kyphosis, there is a lot of internal scar tissue, a lot of internal tightness, and it's impossible with the foam roller that's working on the superficial area or the hand, the knuckle, to go deep enough to release those deep adhesion, and that's why it's not gonna release it. But the other problem is if you have a lot of inflammation due to the kyphosis, do you want to rub it? Because when you rub it, that's gonna inflame it more. When you inflame it more, it's gonna cause more scar tissue, and it will get you to that worse vicious cycle of inflammation and proliferation going back and forth. The other thing that commonly used is stretching, and I personally do not recommend stretching to my patient because based on a study, it either provides temporary relief, and if you overstretch, you're gonna cause more inflammation. There are other alternative safe options than stretching you can do. And as I mentioned to you, you have a knot in the muscle and or a micro tear in the muscle. Do you want to stretch it to really make it tear more? So you will not be able with the stretching to break the scar tissue, to release fascia restriction, muscle spasm, or trigger point, but actually too much stretching will cause inflammation. That's why when I work with patients, we never start with exercises. We always start with breaking this vicious cycle and then doing the exercises. The other thing that's commonly used by a healthcare provider like physical therapy, chiropractor, occupational therapist is joint mobilization. But when we look at the normal healing cycle, joint mobilization is just moving the joint. It's not going to do anything to the inflammation. Actually, if you overdo it, that will cause more inflammation. And it's not going to break the scar tissue, release the fascia restriction, because all of these in the soft tissue, it's not in the joint. Yes, correcting the joint is like it's stuck in the kyphosis structure issue, but the problem is the musculoskeletal is the one that put the joint in that curvature abnormality. And based on the studies, joint mobilization either provides short-term pain reduction or no pain reduction. The other thing that's been used is strengthening exercises, but the problem with that is if you do strengthening exercises during the inflammation stage, you're going to inflame it more. The other problem is if you don't release the adhesion, the strength exercises not going to break the scar tissue, the fascia restriction will not correct your kyphosis, temporarily will correct it, but those adhesion, those nodes will get it back to the bad position again. So the main question, how to treat the root cause of kyphosis. As I mentioned, the partial kyphosis and Shoremon kyphosis can be corrected if we eliminate the adhesion and then doing exercises. So we need to focus initially of releasing everything that tie it, the scar tissue, the fascia restriction, and if you have inflammation, we have to really decrease that inflammation. And then after that, we need to do the exercises to correct it, to strengthen the body in that position. We cannot strengthen the body while you are here. That's a bad starting position for doing exercises. We need to start here to do the right exercises to keep you in the right position. But we cannot get you here unless we remove all the adhesion, all the tightness in the back. So, how to do that? We have to break that vicious cycle from both ends, the inflammation stage and the proliferation stage. As I mentioned, with those patients, they usually have excessive issue with the proliferation stage. If it's chronic condition, you might have inflammation, mild or moderate. It depends on how long you have the kyphosis. That will determine how much inflammation you might have. So how to work on inflammation? What I personally use, I use the MagnaHeal 2. This is very strong magnetic device that actually the magnetic range about 3 inches, and that's what I use it with the kyphosis patient to put it on their back, or I use the MagnaHeal Pro, which is bigger size, to decrease the inflammation in the mid back or the area that has a kyphosis. And then while we working on decreasing the inflammation, we release all the tightness. For moderate to severe inflammation, you might need to use the MagnaHeal Pro. Moderate inflammation to mild inflammation, MagnaHeal 2 should be good enough to really decrease the inflammation while we releasing everything else. If someone has other health issue that could slow down the normal healing cycle, I usually recommend to take advantage of Ask ASTR. It's a free online medical evaluation. The software will help you to guide you to figure out if you have possible vitamins, mineral deficiency, and what steps you need to take. And it usually takes about 5 minutes to answer the questionnaire. So if you have chronic condition with including like other health issue that slow down your normal healing cycle related to inflammation or vitamins mineral deficiency, it's a good option to utilize Ask ASTR. But in general, if it's mild to moderate inflammation, MagnaHeal 2 is good enough to really start to decrease that internal inflammation while you're working on the proliferation simultaneously. So what should we do for the proliferation? We have to work on the scar tissue, trigger points, fascia restrictions. So what I personally use, I use the A3 to break down the scar tissue, the superficial ones, and I use the A5 to work deeply to break deep adhesion, deep scar tissue, deep fascia restriction, and trigger points. And that's why I said massage and foam roller are not effective, because mechanically impossible with the foam roller to go deep enough as the A5, or with the knuckle. When you use your knuckle for massage or your hand for massage, it's not going to go deep enough to really release deep adhesion. And think about this way: if you have deep scar tissue, deep adhesion, if you cannot apply mechanical force, you will not be able to release it. Why? Because if you have a screw in your motor and you want to unscrew it, and you just have a short screwdriver, that's not gonna reach to unscrew the screw, so it's not gonna work. The same thing in the body. If you cannot apply mechanical force on the tissue that's restricted, you will not be able to release it. So the A5 can go deep 2 inches to 3 inches in the body. So we'll release the whole mid back, the whole back actually. We'll release the chest area, and then after that we can introduce the exercise. We cannot do it the other way because it doesn't work this way. The other thing that's very commonly overlooked by healthcare provider is the fascia system. Briefly, I'm gonna explain the fascia system here because it has significant effect on the kyphosis. So you can see the fascia system, the fascia layer, the superficial fascia layer wrapping the entire body. It's like a Spider-Man suit that's wrapping everything. In the image here, the white filament tissue here, these are the fascia tissue. And when you go by meat next time, look at the white filament. That is the fascia system. And it has significant effect on the kyphosis, because when you have fascia restriction, it's like you're wearing a t-shirt 2 to 3 size too small. And it's happened with the kyphosis patient. Their fascia is very tight in that location. If you do stretching forever, you can do that. It's not going to release it. We have to release the fascia layers so you will be able to have a proper posture. So to make things complicated, but don't worry, the treatment very simple. The fascia system has two major categories, the superficial layer and the deep layer. And the deep layer is actually divided to 4 subcategories. And each of those categories have 2 to 3 sublayers on the top of each other. So we have the apparatic fascia layer wrapping a group of muscles, and then the epimysin wrapping each individual muscle. You can see it here, the epimysin, and then we have the premiysin wrapping a group of bundle of muscle fibers, and at the end, each individual muscle fiber wrapped with the endomysin fascia layer. So to release the fascia system, you cannot pick and choose which layer to release it, because it's very common with the kyphosis that you have restriction and adhesion in all of these layers. And you can feel it if you feel tight restriction or band, or you feel like there is a rope in the back, rope feeling or a string feeling. That's a very high chance fascia restriction. It's the fascia system is suffocating the tissue underneath it, and it's basically compressing it underneath it. That's why massage and foam roller will not gonna work, because you cannot really just rub the superficial layer and expect the deep layer be released. You have to go deep enough to really release those areas. So what I personally use, I use the A1 to release the superficial fascia layer and the apparatic fascia layer. Then I use the A5 to release the epimysin, premiysin, and endomysin. And with the kyphosis patient, when you start to palpate, even at home now, or you have family member, palpate in the back, the area that has the curvature, you will notice there is knots, there is a scar tissue, there is adhesion, there is a band feeling, there is very hard soft tissue that should be soft, not hard. And when you start to do the same thing in the front here, because that's compensating for the curvature, you will feel the same. So the treatment, how to treat the kyphosis. If you have partial kyphosis or Shoremon's kyphosis, that can be treated with the tools and corrective exercises. So the proper treatment protocol is, if you have inflammation, I use a Magna Heal to decrease the inflammation, and then immediately while we're working on that, releasing all the adhesion in the back, in the front, all the knot with the tools, and then immediately after that release, the patient will be able to correct their posture. But we have to do something called core stabilization to strengthen the internal core muscles and correcting the posture with the biofeedback. That's more effective than just doing strength exercises, and that's called function training. And based on the studies, function training is more effective than just doing like rows or doing like certain other exercises or stretching. So immediately while working on the inflammation and proliferation, correcting the posture, correcting the core, and make sure everything pain-free, so you will maintain that good posture after the release for the kyphosis issue. And that's conclude our video. If you have any question or comment, leave it in the comment section below, and I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.